Hello, everyone. I am Dr. Nikunja. I am Assistant Professor at Sanjeevi Institute of for Orthopaedics and Rehabilitation, College of Physiotherapy. Today, the topic at matter is risk factor screening for health and fitness. This particular topic is not only important from cardio or MSK or community point of view, but it is necessary for each and every patient that walks into the OPD and who is basically up for exercise. So how do we screen for risk factors? Uh, Risk factors associated with exercise. So the most common risk factors which are associated with exercise are musculoskeletal injuries. We very commonly find them with respect to overexertion, be it ligament tears or so on and so forth. Risk of sudden cardiac death. More and more news have been coming forward with respect to this. There have been a lot of cases where a player has died on the football ground or the cricket ground and so on. Risk factors of cardiac events associated with exercise. Even if there is no sudden cardiac death, but the occurrence of angina or other such cardiac events can be associated with exercise. Exercise pre-participation screening. Pre-participation health screening before initiating physical activity or an exercise program is a two-stage process. All of this is from ACSM, and the need for medical clearance before initiating or progressing exercise programming is determined using the updated and revised ACSM screening algorithm. The algorithm we are going to learn forward. If indicated during screening, medical clearance should be sought from appropriate healthcare provider. So these are certain terminologies that we will be using further on. And I think most of us will be familiar with these. Exercise participation, cardiovascular diseases, which we already know, metabolic diseases. For the sake of this, we consider that as type 1 and type 2 diabetes. Uh, then the signs and symptoms. These are just the terminologies that we are going to use forward. Okay, so even if the patient does not have a particular disease, but he is showing the signs and symptoms. For example, chest pain during activity, discomfort in chest, neck, jaws area, which can result from cardiac ischemia, shortness of breath on exertion or at rest. Then start. Start again. Hello everyone, this is Dr. Nikunja. I am from Sanjeevi College of Physiotherapy. Today, the topic at hand is risk factors screening for health and fitness. So, what are the risk factors which are associated with exercise? The risk factors which are most commonly attributed to exercise are either musculoskeletal injuries, which we very commonly find across in the form of ACL tears and multiple fractures or yeah, shit. Restart, restart. Restart. Good afternoon, everyone. Restart. Hello, everyone. I'm Dr. Nikunja. The topic that we are going to discuss today is risk factor screening for health and fitness. So, why do we need to scan for risk factor is in order to prevent an unforeseen event which might come in the near future if not checked prior. So, what are the risks associated with exercise? There are three, we can categorize them into three major events. First is musculoskeletal injuries. Musculoskeletal injuries are fairly common. I think we all can agree where we see a lot of ligament tears and fractures and so on and so forth happening during sports. sports and everything. Risk of sudden cardiac death, especially young athletes. This has been coming up nowadays a lot with respect to football and cricket and so on and so forth. Risk of cardiac events associated with exercise. So even if there is no sudden cardiac death, but cardiac events like myocardial infarction or let's say stable angina occurring during exercise is happening. So, exercise pre participation screening. So, whenever a person wants to enroll into exercise, wants to start with the exercise, there is a definitive algorithm which the ACSM has given with respect to screening. So, let's see what that is in the next upcoming video. And if required, with respect to that algorithm, if required, we need to seek medical clearance from the appropriate healthcare provider with respect to the disease. Uh, so, what is ACSM pre-participation screening algorithm? So, let's for whoever comes and whoever wants to enroll into exercise, let's just classify them under two headings. One who does not regularly participate in exercise, and the another one who actually participates in regular exercise. So the one who do not participate in regular exercise, they are the first timers who are maybe, and by regular exercise we mean that the patient exercises for at least 30 minutes at mild to at moderate intensity for 3 or more days a week in the past 3 months. So this is the criteria for regularly exercising. So once if we know the patient is not regular or up to date on his exercises, we see for if the patient has any cardiovascular, metabolic or renal diseases, or if the patient shows with any signs of these diseases. So let's say the patient does has no cardiovascular, metabolic or renal disease, and it doesn't even have the signs which suggest these. Then medical clearance is not necessary for such patients or such individuals, and light to moderate intensity exercise can be recommended. May gradually progress to vigorous intensity once they are comfortable with moderate intensity exercise. Here, the medical clearance is not extremely necessary. Then comes the patient has known cardiovascular, metabolic, or renal diseases, but currently is asymptomatic. Even when the patient is asymptomatic at present, medical clearance is recommended. So, but once the medical clearance is sought out, the patient can start with light to moderate intensity exercises and may gradually progress as tolerated according to ACSM guidelines. Then the third category of patients comes where there are some signs or symptoms which are suggestive of cardiovascular or metabolic or renal diseases, irrespective of if they are diseased or if they are not of any known disease. Then medical clearance is recommended. Once medical clearance is sought, light to moderate intensity exercise can be recommended. And again, similarly, can be gradually progressed to ACSM as per ACSM guidelines. Now, next comes our participants in regular exercise. Now, these are the people who are engaging in a regular exercise on a daily basis, on at least three, like the definition that we saw. Now, the first category comes is no cardiovascular, metabolic disease or any signs of the above diseases. Then medical clearance is not necessary. These patients can continue with moderate to vigorous intensity exercise. Since these participants are doing regular exercise, we need not start with low intensity. We can directly start. They would be directly starting at moderate or vigorous intensity and can gradually progress as per the ACSF guidelines. Now, they have a known condition and and even if they are asymptomatic but are regularly exercising, medical clearance for moderate intensity exercise is not necessary. Since they are regularly exercising and there are no symptoms which have exacerbated with the regular exercise, they can perform moderate intensity exercise without clearance. But medical clearance within the past 12 months if no change in symptoms is recommended before engaging in vigorous intensity exercise. Even if there is no change in symptom and you want to progress to a vigorous intensity of exercise, then medical clearance is expected. Then continue with moderate intensity exercise and following medical clearance may gradually progress to vigorous intensity as tolerated. Then the third category comes where irrespective of if they are diseased or not, they are having symptoms. And as and when, as we saw previously, if at all you see any sort of symptoms, then medical clearance is anyway recommended. And so, following the medical clearance, light to moderate intensity exercise can be started and can be gradually progress as per tolerated. Now, here we saw certain terms like cardiovascular, metabolic, and renal diseases, light, moderate intensity exercise, vigorous intensity exercise. So, exactly what do those terms mean? So, when we talk about cardiovascular diseases, here we are talking about cardiac, peripheral vascular, or cerebrovascular disease, including your stroke and everything. Then, with respect to metabolic diseases, we talk here about type 1 and type 2 diabetes mellitus. Signs, and when we say that there has to be no signs and symptoms present with respect to the disease, it means what are those signs and symptoms? So at rest or during activity, including pain, discomfort in chest, neck, jaws, arms, or anything which can be caused due to ischemia, shortness of breath at rest, or with mild exertion, dizziness or syncope, orthopnea, paroxysmal nocturnal dyspnea, palpitation, tachycardia, intermittent claudication, known heart murmur, unusual fatigue, shortness of breath, etc. Um, Light intensity exercise is usually 30 to 39% of heart rate reserve. Moderate intensity is 40 to 59% of heart rate reserve. And vigorous intensity is more than 60% of heart rate reserve. So, these are the basic terminologies that we saw in the previous slide. Then, what are the major signs and symptoms? Again, this we have already seen. So, pain and discomfort, shortness of breath, dizziness or syncope, orthopnea, ankle edema. This is a prominent feature of uncompensated heart failure. Palpitations or tachycardia, intermittent claudication, heart murmur, unusual fatigue. This is not very easily reported, so make sure you ask for it. Now, there are other methods of screening. Supposedly, a patient does not, supposedly a person is wants to start exercise and wants to know if he is fit for exercise. So these are self-administered. These are called as self-administered methods of screening. So there are questionnaires available. For example, PARQ, which is Physical Activity Readiness Questionnaire, which you can fill out to know. So if you answer, if you are physically fit, then your answer will be no for most of the questions, and rest is okay. Then cardiovascular risk factor screening. So when we talk about cardiovascular disease risk screening, that means what is how likely is the person to get a cardiovascular disease. So screening with respect to that. So age, men more than 45 years and women more than 55 years are at a increased risk of cardiovascular diseases. Uh, it is because this is because ki women after menopause become more susceptible to cardiac diseases. Family history, heart attack or bypass surgery or sudden cardiac death before the age of 55 years of father or before 65 years of mother constitutes of a positive family history. Cigarette smoking, current smoker or has quit less than 6 months or is exposed to environmental smoke. Sedentary lifestyle, not participating in moderate physical activity at least 3 days per week for 3 months. Obesity, body mass index, a BMI of more than 30 kg per meter square or waist girth of more than 102 centimeter for men, more than 88 centimeter for women. Hypertension, uh, p- uh, systolic BP more than 140 and diastolic more than 90. mmHg. Then dyslipidemia, for which we see the LDL, which is more than 130 mg per dl, or HDL, which is less than 40. If LDL is the good cholesterol, so it has to be more than 40 mg per dl. Or taking medication, or TC is total cholesterol more than 200 mg per DL. So, and if the patient is pre-diabetic is IFG more than 100, which is mg per DL, or OGTT. OGTT is glucose tolerance testing, more than 140 and less than 199 mg per DL, confirmed by two measurements. HDL more, and this is a negative risk factor. So you get 1 mark for each. So +1, +1, +1 for whatever is positive. And if you have HDL more than 60, you get -1. So according to that, we calculate. So components of pre-participation health screening. So what all has to be seen when you are checking for pre-participation screening? So body weight, for to determine for BMI, waist girth, and composition, apical pulse rate and rhythm, resting blood pressure, auscultation of lung, specific attention to uniformity of breath sounds in all areas, palpation of the cardiac apical impulse, auscultation of heart with specific attention to murmur, gallops, clicks, and rubs, palpation and auscultation of carotid, abdominal, and femoral arteries, evaluation of abdomen for bowel sounds, visceromegaly and tenderness, palpation and inspection of lower extremities for edema, absence or presence of tendon, xanthome, and tendon exanthelasma, follow-up examination related to orthopedic or other medical conditions, test of neurological functions, including reflex and cognition, inspection of the skin, especially of lower extremities in known patients of diabetes mellitus. So now here we have a case study. So for this case study, a 50-year-old non-smoking male was recently invited by his colleagues to participate in a 10-kilometer trial run. He reports currently walking 40 minutes on Monday, Wednesday, and Friday. So this means he's walking for 40 minutes at least 3 days a week. Has done something he has done for years, he says, which is more than again 3 months. The goal is to run the entire race without stopping, and he is seeking training services. He reports having what he describes as a mild heart attack at uh, and he completed cardiac rehabilitation and has no problem since. He has sustained and has a statin and an ACE inhibitor and aspirin during the last visit with the cardiologist, which took place 2 years ago. The cardiologist noted no changes in his current medication. So if we are talking about this particular case, then the patient comes under the category of regularly exercising. With During regularly exercising, he wants to do vigorous intensity exercise. But the patient, even when he does not have any current symptoms, he does possess some known cardiovascular, metabolic, and renal disease. Hence, medical clearance for moderate intensity exercise, which he is clearly doing, is not necessary. But as he wants to progress to a vigorous intensity exercise, medical clearance would be needed. And then he can continue. Thank you.